Welcome, everyone. We welcome to you our Survivor series, part 1, titled Hey, Are You Okay? Conversations on Mental Health and Cancer Survivorship. Today, I am pleased to introduce you to Ms. Melanie Gowdy, who is a part of Gateway to Hope. Ms. Melanie is the Director of Community Outreach and Mobilization with Gateway to Hope. Melanie, please feel free to take it away.
Thank you, Dr. Wyndham. I so appreciate you and this opportunity. Hello, everyone. So my name is Melanie Gowdy, and as Dr. Wyndham stated, I'm the Director of Community Mobilization and Engagement at Gateway to Hope. And today we are really happy to partner with Siteman Cancer Center's program for the elimination of cancer disparities. In their webinar today, which is titled, Hey, Are You Okay? Conversations on Mental Health and Survivorship. So today we're partnering to raise awareness of mental health among cancer survivors. And it's so relevant and so timely because today marks the beginning of National Cancer Survivorship Month. As medical professionals, service providers, support organizations, and advocates, we're all playing a part in the cancer continuum of care to support individuals through the fight of their lives. And daily, we see the immense toll of their journey. We have convened an amazing panel today to discuss the signs and symptoms of mental health among survivors, the barriers that prevent survivors from seeking mental health treatment, and the resources that are available to help survivors who are struggling with mental health conditions. Current research really elevates the benefits of continued services and support for survivors. And today, we hope you leave this discussion with the tools to provide such support. So during today's webinar, you will be muted, but however, feel free to type your questions in the chat. We will also have a Q&A session for you to ask questions of the presenters, and I'm sure you'll have many questions, and I'm absolutely positive that they'll have many answers for you. Also, today's presentation and webinar is being recorded because we don't want to miss a single moment of all of this brilliance. At the end of today's webinar, we ask that you complete an evaluation, right? I know. But the evaluation will be on Siteman's webpage, and you'll get a friendly reminder with a link in the email sent to you by email. The evaluation really helps us to present information that is relevant and needed for you in the work that you do. So today's presentations will go as follows. Dr. Carolina Salvador, MD, Medical Director, Integrative Medicine and Health, DOM Wellness Program. Kait Huelsman, PhD, Psychologist, Siteman Psychology Service. Jennifer Dunn, Siteman Social Worker. And Kristine Kulage, MA, MPH, and Siteman Survivor. So without further ado, let's get started. Dr. Salvador, thank you for being here. We're really excited to hear the information that you have to share. So if you all can't tell, I talk a lot. I'm going to shut up and I'm going to let Dr. Salvador share her information and her resources with us.
Thank you very much, Melanie, for introducing me, and thank you for inviting me to speak today at this event. I'm very honored to be here. So what I'm going to talk to you about today is about integrative medicine, and more specifically, integrative oncology. Some people already know about this kind of emergent modality in medicine, but I thought it would be good to present it here and to show how it may help managing symptoms of survivorship, and in particular, mental health issues in survivorship. So what is integrative oncology? Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and or lifestyle modifications from different traditions alongside with conventional cancer care. So we work with your primary oncologist or radiation oncologist, bringing a lot of tools, and I will go that into a little bit long, but I want, please, next slide. I want to start by telling you that how I feel about how we are and how we are when we suffer from cancer. So I think that everybody is a beautiful garden. We take care of ourselves the best we can, everybody does. But then something happens. Next slide, please. And the garden gets taken away by leaves and shrubs and things that don't belong there. That is supposed to, in this allegory, represent the cancer process. So it really takes hold of the person, the whole person, not just the part that may be sick. Next slide, please. And then what happens is we'll seek treatment and we go have surgery, chemotherapy, or other treatments, radiation. And what happens is most of the time the cancer gets fully cured, but what is left is not the same that was there before we started the journey with the cancer experience. So here is where integrative oncology, integrative medicine comes along to build up that garden again that may not look the same as it did before, but it will be a beautiful garden, and hopefully we can make that happen for everyone. Next slide, please. So integrative oncology is the whole person approach. So it's what this little diagram shows with the person in the center and everything that affects a person represented around the main circle. So it covers, integrative care covers a little bit of everything. Next slide, please. And these are the modalities that we use because you have your oncologist, radiation oncologist, or surgeons taking care of all the cancer issues. We try to help you with your diet, lifestyle modifications that will make your quality of life better. We may use natural products and supplements. We will recommend some of the mind-body modalities such as yoga, tai chi, qigong, meditation. Also manipulative modalities such as massage, acupuncture, chiropractor care. Energy-based modalities are such as Reiki and healing touch. And we also have entire whole systems like the traditional Chinese medicine, the Ayurveda, which is the traditional Indian medicine, naturopathy, or even Native American medicine. Next slide, please. So we know that this integrative oncology, because we have done many studies, can help managing side effects of treatment, improves patient-reported outcomes, contributes to overall survival, and increases patient satisfaction. Next slide. And this slide, I wanted you to focus on the line that is red, that says distress, anxiety, and depression. And these are the modalities that help treating these survivorship symptoms and issues. Meditation and mindfulness-based stress reduction, that we will hear a lot more later on about that. Yoga, music therapy, exercise, and nutrition, all of those can help either prevent or with the treatment of anxiety, depression, and other mental issues in survivorship. And I leave the quantitative data to my colleagues that will be telling you all about that. But next slide please. That doesn't mean that all the other modalities in integrative oncology do not help. It's that we don't have enough evidence yet that supports their use. So it's for that we call it evidence-based. And the other thing that I have to mention is that, like any other medicine or medical treatment, some things may work in one person, but may not work in others. But in any case, individual patient care via evidence-based approaches helps to maximize healing and well-being. And with that, it helps to maintain and to achieve better overall mental health care. And next slide, please. With that, I hope I have given you an overall idea of what integrative oncology is all about and what can help you with in survivorship, or really since diagnosis until until the end of all of our life. I think it will become mainstream for all of us, not just for cancer care. So if you wish to have a consultation with integrative oncology, you can talk to your treating physician to refer you to the clinic, and I will be happy to see you there in this new clinic that we have at the South County. So thank you so much for listening, and I'll say goodbye for now.
Thank you, Dr. Salvador. Goodbye for now, but we'll definitely be coming back to you with questions. I was taking notes, and I definitely have questions, good questions, and I'm sure our audience will as well. So now we're going to turn to Dr. Huelsman. Again, I'm looking very much forward to your presentation and what you have to share with our group today. Dr. Huelsman, I think you might be muted.
Is that better? Thank you. Okay, well, I'm Dr. Huelsman. I'm a psychologist with the Siteman Psychology Service here at Siteman Cancer Center. So today I am going to be talking about, there we go, just the common mental health concerns that we see for cancer survivors and some different treatment options of those. So it is not uncommon for people with cancer to experience mental health concerns after a cancer diagnosis. And these concerns can continue as someone kind of transitions into this area of survivorship, meaning that they're no longer in this active treatment phase and are instead focused on cancer recovery, surveillance, or maybe even continuing maintenance treatments. So looking at just some prevalence rates in research suggests that about 12 to 14% of cancer survivors experience depression, which is compared to about 7% of the general US population. So we see that some of these mental health concerns are higher for cancer survivors. Anxiety is more common, with research suggesting about 18 to 20% prevalence in cancer survivors, compared to about 2.9% of the general US population. And of the most common mental health concerns that cancer survivors report is this fear of recurrence. And that is about 80% of cancer survivors endorsing these fears. And of course, this is unique to cancer survivorship. And some individuals who have experienced cancer can go on to show symptoms of post-traumatic stress disorder, or PTSD at about 10 to 15%, while this is only about 3.5% in the general US population that experience diagnosable PTSD. And then due to the amount of physical and psychological changes that someone can experience, during a cancer diagnosis and through the transition to survivorship, research suggests that about 19% of cancer survivors can experience an adjustment disorder. This can include difficulties coping with grief or kind of the loss experienced as a result of cancer diagnosis and treatments. And adjustment disorders are also one of the most commonly diagnosed mental health concerns in the general population as well. And then finally, about 40% of individuals in cancer survivorship experience insomnia. And this can include difficulty falling asleep as well as interruptions in their sleep. This compares to about 6 to 10% of the general US population. So looking at quality of life, this can be defined as one's perception of their general well-being. So this includes many areas like physical, mental, financial, social, cultural, spiritual, and many others. And for cancer survivors, research suggests that about 10.1% report poor mental health related quality of life, compared to about 5.9% of the general population. And cancer survivors are also 2 times more likely to have mental health concerns that interfere with their day-to-day activities compared to the general population. So why do cancer survivors have these higher rates of mental health concerns compared to those who have not experienced cancer? Well, there's several contributing factors to that, which you can see here on this slide. So first, when a person is diagnosed with cancer, they often receive this intensive medical care with frequent follow-up and treatment appointments with their oncology medical team. But if someone completes their active treatment and transitions into the survivorship area, the frequency of that medical care often decreases. And they may experience kind of a shift of focus in their care, again, to this of recovery focused surveillance or just wellness overall. And for many, this can actually intensify any feelings of anxiety, as patients often find the shift in care unnerving. And this is also related to a perceived sense of decreased support from the medical team because you're not meeting with them as often, and the sudden reduction in appointments now that treatment is completed. And cancer survivors also then begin to resume their, quote unquote, normal day-to-day routines once again, including maybe return to work, participating in the household chores or tasks that maybe they were not doing as much of during treatment, and maybe even resuming some of those social roles within the family or among friends. And so what many cancer survivors find is difficult resuming how life was prior to their cancer diagnosis and undergoing treatment. And many experience alterations, which are sometimes temporary or sometimes permanent in their life roles. And this can be due to continued experiences of late or long-term side effects of treatment that continue to disrupt that day-to-day functioning. And as previously discussed, those mental health concerns as well can continue to cause difficulty in one's day-to-day life for cancer survivors. And so the transition and support from their loved ones can be a challenge as well, because many patients often report that as they transition back to their life roles, that many family members or friends assume that they're okay, that things are going fine now that they're finished with treatment and that they no longer need that same level of support. But for many cancer survivors, it can be difficult to experience this change in the level of support. And many individuals continue to find it difficult to reach out and ask for help when needed. So how can you tell if someone you know is experiencing a mental health concern? Well, I have some of the outward signs that you can see here on this slide. So for depression, you may find withdrawing from others, crying, difficulty focusing. Anxiety can be more like restlessness or jitteriness, tensing up, maybe being a little bit more irritable. Then, as we mentioned, some of the trauma-related experiences as symptoms of PTSD that can look often like a combination of depression or anxiety. And then signs of insomnia can also be present, difficulty focusing. And then those adjustment concerns can often have those same indicators as depression and anxiety as well. So what we can do about that from a mental health perspective is that there's many different treatments there that can be available. And so these are some of the different evidence-based treatments, as Dr. Salvador had mentioned, the evidence-based aspect of that. These are some of the evidence-based treatments that are available for mental health treatment for cancer survivors. And then other people may also find it helpful to meet with a psychiatrist for medication management options. So just to review some of the resources here in the St. Louis area for our Siteman Cancer Center patients, we have the Siteman Psychology service, which is a free service with a cancer-related focus for any Siteman Cancer Center patients or their caregivers and loved ones. And we're made up of 7 psychologists, and we have some interns, residents, doctoral students that train with us. And we work with patients all from the initial diagnosis all the way through survivorship or end of life. And we have services that are both individual and group. For services outside of Siteman Cancer Center, you may find looking at psychologytoday.com, and you can find a therapist there. And here are some other local resources in the St. Louis area that provide evidence-based treatment. And it is also helpful to reach out to insurance companies as well. And then finally, if there's any crisis that you may be experiencing, we have several different mental health crisis resources as well available on this slide. Okay, and we'll save our questions for our Q&A at the end.
Thank you so much. And I really appreciate that. We're going to save our questions for the end. Definitely going to provide some appreciation and insight to that slide, the indicators, that, signs to help know and be able to see, hey, if someone is. So I really appreciate that resources at the end. Thank you so much. I will have questions. I imagine the audience will as well. So next we're going to transition to Jennifer Dunn, Siteman social worker, and I'm so glad to have her as a part of this panel. I'm a social worker by profession, so of course I love and embrace social workers in all spaces, and I really think we really bring a unique support in this area. So Jennifer, I'm so excited. I'm always excited, but I'm really excited to hear what you have to share today.
Thank you. Can everybody hear me okay? Thank you, Melanie. So my name is Jennifer Dunn. I'm a certified oncology social worker working for the Department of Medical Oncology here at Siteman Cancer Center. And I agree, Melanie, I appreciate being invited to come because I'm going to talk a little bit about what are some of the psychosocial influences or things that impact an individual's ability to cope with their cancer diagnosis and their transition to survivorship, as well as looking at what are some of the barriers that prevent people from seeking psychosocial care or mental health services as a result. So just briefly, I appreciate the information provided by Dr. Huelsman. I'm going to see. There we go. So just a little bit of information about cancer and mental health and this bi-directional relationship that exists between cancer and mood disorders such as depression. Just like Dr. Huelsman had mentioned, that we approximate that about over 1/3 of patients with a cancer diagnosis have symptoms or have potentially a clinical diagnosis of a mood disorder, including depression, anxiety, and as Dr. Huelsman had mentioned, there's increasing research to indicate that individuals with a cancer diagnosis are also suffering symptoms of post-traumatic stress disorder. So there's a lot of research to indicate that people are struggling with their mental health after a cancer diagnosis. We also know that research tells us that depression and its incidence and severity increases with failure for us to manage pain and symptoms for individuals. So the greater pain or symptoms that an individual is experiencing, the greater incidence they are of suffering from depression or anxiety or other mood disorders. We also have research that indicates that people who experience mood disorders or depression prior to their cancer diagnosis actually have a higher incidence of cancer in the community. And there tends to be a correlation between depression and cancer treatment outcomes. So when we are failing to address someone who is struggling with depression and their symptoms of depression, we know that when we address those symptoms, when we address depression, that they actually do better in their treatment. They tend to maintain their appointments better. They take their medications on time and things like that, and their treatment outcomes are actually improved. And then finally, we know that there are interventions that help reduce symptoms of depression and anxiety, such as pharmacologic interventions, medications, and psychotherapy counseling services that Dr. Huelsman and Dr. Salvador had discussed, those integrative medicine treatments that we're starting to integrate into our cancer services here at Siteman Cancer Center. So what are some of those psychosocial influences that impact somebody's ability to cope with their cancer diagnosis? Psychosocial influences are going to be those day-to-day things that we all are trying to navigate, work, family, our finances, and things like that. So some of the things that have been identified that increase distress or can impact a person's ability to cope with their cancer starts with access to care. Looking at what kind of access do people have to their providers? Do they have to preventative care, to follow-up care? Does this person have medical coverage that they're not concerned about? How am I going to pay for this? Am I going to get subpar care because of the type of insurance that I have or don't have? Access to care could also be something like distance from your treatment facilities. Here at Siteman, we have patients that travel from 3, 4, 5+ hours away to access care, simply because they don't have access to strong cancer care in their community, and that can cause additional distressors such as travel costs. I mean, gas is, in some areas close to $5 a gallon right now, and so we're trying to address navigating the financial burden that access tends to have. And leading into that is the financial distress that cancer comes along with. As a social worker, one of the first questions I get from many people is, how much is this going to cost? Am I going to be able to afford my care? It's something that we navigate on a daily basis here. So we're looking at people who do have insurance coverage. What kind of deductibles do they have? Some people have co-pays of up to $75 to see their specialist. So to come see their oncologist can sometimes be a burden in and of itself because of co-pays. Medication costs are significant when it comes to cancer care. Cancer treatment tends to be moving in a direction where a lot of people are getting treated with oral chemotherapy medications, and they're very, very expensive. Some co-pays can be greater than $1,000 a month. And I've had patients ask me, how am I going to afford this? Am I going to have to forego treatment because I can't cover the cost? And then along with the cancer diagnosis, many people tend to lose household income as a result. Either they have to stop working or they don't have paid medical leave benefits, such as short and long-term disability. If they're lucky or fortunate enough to have those benefits, it comes at a reduced income. For many people, it's only about 60% of their day-to-day income. And then some people lose their income altogether or transition to Social Security disability benefits. And so people are trying to navigate, how do I continue to pay my rent and my mortgage while also navigating this loss of income that I've had. Personal factors play a big influence on a person's ability to cope. One thing I wasn't quite aware of is that a person's age at the time of their diagnosis tends to be a big indicator of the amount of distress that they will experience. Young adults that are trying to navigate raising children, working, their personal health tend to have higher levels of distress because they're thinking about, how am I going to continue to pay my bills? How am I going to talk to my children? How am I going to continue to work, and so forth. But other personal factors could be things like a crisis of faith. People who are strong in their faith or their spirituality might be questioning, why is this happening to me? Why has my God allowed this to happen to me? So there's a number of personal factors that are indicated. Social factors, I think Dr. Huelsman discussed loss of social support. Social factors can contribute significantly. People who have very limited or support systems or tenuous family dynamics. I think a lot of people don't realize that if there's a lot of family conflict or dynamics before a cancer diagnosis, oftentimes after that diagnosis, those dynamics get expanded or for a lack of a better word, but that conflict doesn't typically tend to go away. Sometimes they tend to get exacerbated, and so support. And limited support can certainly influence a person's ability to cope if they don't have those people around them supporting them. Other social factors are things like, does an individual have a stable housing or living situation? Is it a safe situation, or is it unstable in some way? We tend to see many patients here at Siteman who, are living in their car from day to day, or trying to find stable housing, or we're assessing people for, are they at risk of things like domestic violence and things like that. So those are some of the social factors that could potentially contribute to how someone is coping. And finally, mental health factors. We know that people who suffer from some kind of mental illness like depression or anxiety or other mood disorders are at greater risk of having distress or increased mental health concerns after their diagnosis. I often find myself asking patients, do you have a history of depression or anxiety or other things? Because we want to be able to provide as much support as you and get you connected to the right resources so that we can make sure that we're addressing those needs as well. So why is this important? Why do we bring this to your attention? And the reality is that even though we may be screening people for depression and referring them for treatment, many people choose not to access care. And what we have learned is that percentage could be reported as high as 86% of people who don't access those services, who don't get that additional level of support. So what are some of the barriers that might be preventing someone from accessing care? There's a group of researchers, Pachansky and Thomas, who back in the 80s identified the 5 A's of barriers to medical care. And I really think that they align well with why there are barriers to also accessing mental health services. So that first A is accessibility. For people who lack insurance coverage or have limited insurance coverage that maybe doesn't provide mental health services, are going to have historically had a more challenging time trying to access mental health services. But accessibility could also be things like transportation barriers. I can't get there. The person I've been referred to is on the other side of the city, and I have to take public transportation. Or we're now living in a post-COVID world where everything is virtual. So if someone lacks access to the internet or their ability to access telehealth, that could be another accessibility barrier. The availability of clinicians in one's area or likewise is also a barrier. It's estimated that about 96% of U.S. counties lack access to psychiatrists or psychiatric nurse practitioners, people who can address mental health illnesses. That's a large percentage of the country that doesn't have immediate access to mental health clinicians. It's also indicated that if a person lives greater than 50 miles from their cancer center, they are less likely to accept a referral for a mental health clinician. Right now, we are in kind of a mental health crisis after the initial COVID crisis. So finding a clinician can be really challenging, and also finding someone who understands the cancer process or what it's like to have cancer. Many clinicians are not trained in cancer care and the mental health services for that. Accommodation is another barrier. I am struggling with finding clinicians that can accommodate people who have certain language barriers at the moment. We see a lot of patients here with different types of head and neck cancers who maybe have had their voice box removed or have difficulty with challenges with communicating verbally, and finding a clinician who takes their insurance, who also can accommodate maybe just their language barriers has been a real struggle for a lot of folks. For one, a barrier tends to be affordability, especially when folks have no insurance or insurance that doesn't cover mental health services. This tends to be one of the number one reasons people don't seek treatment, because mental health services can still be expensive if you don't have access to affordable resources in your community. And then finally, the fifth A is acceptability. There tends to be a low perceived need for treatment of mental health care, primarily because a lot of people tend to believe that depression and anxiety are a part of the cancer experience. People find that they want to be able to try to handle their problems on their own. And they also fear having to take more medication. You're already taking medicine with a lot of side effects. And, by taking more medicine, am I going to have more side effects that I wasn't anticipating? As well as there's a long history of stigma that's associated with mental illness and treatment. And so finding that in order for someone to want to seek out mental health services, they have to be willing and accepting of that treatment. Finally, I just wanted to include the idea of hierarchy of needs. We see a large population here in St. Louis of individuals who really have a hard time meeting just their basic level of needs. And Maslow, in his hierarchy of needs, said we can't really achieve those higher levels of insight and clarity until our basic level of needs is met. So things like access to food. Do I have food to eat? Am I able to pay things like my electric bill? Or am I safe in my environment? Before we can get to that higher level of need. It's I think for many people it's a privilege to be able to have that time and the resources to address their mental health, because so many people are still just trying to address their basic level of need. So I wanted to bring that to people's attention as well. So what are some of the resources that are available? Dr. Huelsman discussed Siteman Cancer Center Psychology Services. Of course, we provide free services to patients and their families affected by treatment. She also mentioned Psychology Today, where you can explore based on your location, your insurance. You can try to find a provider in your area. There are also cancer-specific support groups here in the St. Louis area, as well as virtually, that people can participate in. Again, Siteman Support Services offers a number of these support programs. We are also fortunate enough to have a chapter of the cancer support community here in St. Louis. They provide free support services, support groups, mindfulness, yoga as well to people impacted by cancer. And then there's also a national organization known as Cancer Care. They have a number of online forums, support groups for caregivers, diagnosis-specific groups that are free and you're able to register for. There are community mental health centers. All of our universities that provide mental health service training offer a community program. There's one here through Washington University. UMSL has their community psychological services. SLU also has one. These are people who are training in their services, PhDs, MSW, or master's degrees that are providing their services at low or no cost. There's organizations like Provident Behavioral Health and SSM Behavioral Health Urgent Care. There's also Behavioral Health Response. There's a 24-hour crisis hotline and the National Suicide Prevention Lifeline. And then finally, you can ask your team, is there an oncology social worker that I can speak with? We can help address some of these barriers if there's things that are contributing to your anxiety, and then we can discuss the different resources available in the community. That's what I have. Thank you.
Well, you had a lot. And I so appreciate it. I myself feeling like a bobblehead, just in agreement and in solidarity on so much that you elevated. And what really resonated with me is how you articulated that a lot of these barriers, they appear to be systemic and institutional. And I find that, I don't know if anyone else has this experience on the panel or in the audience, but as advocates, we have like a dual relationship with both clients and institutions. So we have the experience of helping people navigate barriers individually, but we also have the ability to be able to challenge some of the assumptions and create some systemic change. And when you outlined all of those barriers, accessibility, affordability, that's what I saw. I saw systemic and institutional barriers. So I really appreciate you elevating that, because a lot of times when we think about these influences, we think about them individually, but we don't realize that sometimes our systems and institutions are reinforcing some of these barriers. So thank you so much for elevating that.
Thank you. Thank you.
And now we have an amazing opportunity to hear from a survivor, an amazing survivor, Kristine Kulage. I hope I pronounced that right. I've been trying. I apologize if I didn't, but please charge it to my head and not my heart. We're so happy to welcome you into this space and to acknowledge your bravery and your vulnerability and sharing your story. And our hope is that by you sharing your story, that you can help provide a perspective that is uniquely yours and your communities to help us really understand what your journey is and understand how we can support you and those like you. So welcome, and I'm happy and open and willing to hear what you have to share.
Okay, thank you very much. I've actually written out my story because I wanted to get a few important points in, and if I talk off the cuff, I'll end up talking too long. So I'll try to make it sound not so much like it's a written dialogue, but it comes from my heart. So yesterday, May 31st, 2022, was my 52nd birthday. I had two things to celebrate. First, that my 74-year-old mother's MRI that she waited 3 days to get back came back only showing an itty-bitty stroke, which is the very best kind to have, according to her doctor. Second, I am celebrating that I'm finally able to get my hair fully into a ponytail again for the first time in 22 months. That was when my dad, the only one brave enough in our family, agreed to shave my head in advance of beginning my chemo treatments. By the way, that decision ended up being one of the best ones I made in my cancer journey and actually saved me a lot of mental anguish I would have experienced with hair gradually falling out in the shower or waking up with chunks of hair on my pillow in the morning. I was deathly afraid of that. So I began sharing my cancer journey, a cancer journey which took place entirely during the height of COVID, with mostly mental challenges and conscious decisions to view life differently. Because to me, the biggest challenge I have faced has been my mental and emotional state of mind. Although I suspect I was suffering for at least 6 months prior, I was diagnosed with stage 3C clear cell ovarian cancer on June 15th, 2020. And of course, it was emphasized by my oncologist that clear cell is the most aggressive type. So this is the type of thing that a cancer survivor faces on a daily basis, dealing with the odds, dealing with something that, for the most part, is completely out of their control. I suspect there are not many other situations in life that are more difficult than living with life-threatening cancer. So for time's sake, I won't go into my journey of how I got my diagnosis, but know that it was not smooth, to say the least, and took quite a bit of avocation for myself to get the scan that I needed that day in the ER to get some answers. I'm still grateful to this day for that one ER doctor, and I promise to send him a letter someday. So with my mom holding my hand as I lay in the bed, he gave me those most dreaded words. And my world changed forever. After 2 weeks of completely debilitating anxiety, on July 1st, 2020, I had surgery, which included a complete hysterectomy and removal of visible cancer that had unfortunately spread to my lymph nodes, my liver, and my lungs. Pathology reports 2 weeks later revealed the grim diagnosis. Current numbers for my stage and type of cancer are a 70% recurrence rate and a 31% 5-year survival rate. However, immediately following surgery, which included a 20-inch vertical suture followed by 4.5 months of chemo, my focus was on physical survival and recovery, not the long-term mental effects. My 6 rounds of chemo lasted up until Thanksgiving of 2020. Visit to visit, blood test to blood test, and scan to scan, I was living at the mercy of test results. Would I make it? And about halfway through my chemo, my cancer did begin to respond, and I was deemed in remission shortly after chemo treatments ended. But as anyone with cancer knows, in remission most of the time is a term that's in remission, which of course means it can always come back. In a time that one would think I would be celebrating, little did I know that my nightmare was just beginning. Looking back, I think that what happened is that after my body and mind were free of the immediate concern of survival, that's when my conscious mind began to focus on the future. And I started asking those questions. How long would I live? Would it recur? Would the chemo work again if I had to have chemo again? And what options were there if chemo didn't work a second time? I became acutely aware of a hard stop in my mortality. Knowing we are all going to die one day is one thing, but facing death unexpectedly when the numbers are essentially against you, that is another beast. I went down a dark hole mentally, spiraling down and down day after day. I spent days in my recliner, which became weeks, which became months. I was frozen into inaction. I literally had no desire to do anything. And any thoughts of a possible future were always tainted with, would I have a future? An opportunity came up for me to refinance my house. But there was the depression and anxiety voice right there saying, why bother? I'm not going to live long enough to pay off this house. Who's kidding? Later, my primary care doctor, who has been wonderful, told me I needed a baseline colonoscopy. Why bother? Why should I go through that horrible procedure? I'm not going to live long enough to get colon cancer. I mean, really? I'll be long dead from ovarian cancer before then. So these are the things that literally go through my mind. Not only was I depressed, but the anxiety of recurrence, the levels were just out of control. I had never had a history of anxiety in my life, and I quickly learned just how debilitating it truly can be. Then in the middle of this mental journey of anguish came the day when my family was visiting, and my dad, who I'm very close to, got out of his chair and said, I'm leaving the house. I can't see you like this sitting in that chair anymore, wasting away. And he walked out. That was a big wake-up call. I was wasting away mentally and probably physically as well. My sister, who really changed things for me, begged me to ask for a referral for a psychologist. And I didn't want any part of that. I didn't want to talk about this. I could not say the word cancer. You have no idea how much I could not say the word cancer. But after much pushback and realizing what I was going through and that I really needed help, I agreed, and that really changed my life as a cancer survivor forever. So working with a psychologist from the Siteman Cancer Center, I first learned to recognize physical sensations of when I was feeling anxiety. Then I learned techniques to quell those feelings. I was introduced to mindfulness and meditation practices for the first time in my life, never done them before, would never have believed that they would do anything. I would laugh at them, but they have proven to be completely life-changing. Shortly after that, I joined the weekly Siteman Cancer Mindfulness Group. I'm sorry, I don't know the exact title, but they meet every Thursday morning. And I absolutely love meeting other cancer survivors, and came to enjoy group meditation and mindfulness exercises done in a group with others where we discuss what our experience was during that mindfulness session and how it affected us. And it's just been a wonderful group. Then in the fall of 2021, I joined the brand new weekly Siteman Cancer Center Survivorship group on Tuesday mornings, led by Dr. Huelsman, and I have been an active member ever since. Again, I can tell you it is so cathartic to be able to talk with cancer, talk about cancer with other survivors. They just understand what you're going through in a way that no one else can, no matter how much they love you, they don't understand. So that has been very, very valuable to me. Finally, I was able to join a nationwide clinical trial called Living Well with Ovarian Cancer that my oncologist introduced me to. This is a 10-week program that was another life-altering experience, which focused on mindfulness, meditation, and purposefully changing our ways of thinking and dealing with living with cancer. If you are a cancer survivor or a loved one of a cancer survivor, I encourage you to take advantage of many opportunities that are available to you. I will tell you that I tried at least 7 or 8 groups, and I have not stuck with them all. Those that don't work for me personally, I simply opted out for personal reasons that didn't jive with my personality, probably. But I guess the 3 that work for me are the ones I've stuck with, and I have not dropped those, and I make them a priority in my life. So in all of these mental health support offerings, I've learned how to recognize what I can control and what I can't control in my life, and make conscious choices to spend my time in my life on things I value the most. I cannot control how long I have in this life, but I can control how I live those moments. It is a daily struggle, and some days are better than others, but I work hard to not give any more of my valuable time to this horrible disease. Every time I catch myself spiraling into a hole of despair and void of hope, I remember that how I spend my time and my days with my thoughts is the one thing I can control. I will also stop what I'm doing at those moments and make time for a mindfulness practice, such as a body scan or a mountain meditation, which is one of my favorites. Living in a way with a focus, living the most meaningful and richest life I can, is what keeps me going when facing my most grim fears. I'm also a devout Roman Catholic, and that has played a huge part in my mental and spiritual health. I have no doubt that I have a closer relationship with God than I ever had in my life. So you just can't go wrong with that. So finally, to close up, today, one day in my 53rd year of life, I'm happy to report that I did refinance my home. I'm on track to have it paid off in less than 15 years. And last week, I did have my first colonoscopy. So I was very proud of myself for that. I work hard daily to live my life to the fullest, knowing that I am doing everything I can to take care of myself physically. I developed a large incisional hernia post-surgery, who I have named Larry. While Larry has been embraced by my entire family, we all want to get rid of Larry. So last week, I started the Siteman Cancer Center weight management program with the goal of achieving a weight that will allow me to be a candidate for hernia surgery in the future. What do I like most about this decision? It's the fact that it's a move toward the future, and it's engaging in action that is aligned with doing something that I can change. So until then, I will wear Larry with the pride of a survivor. Thank you.
Kristine, I just want to take a moment to pause and uplift you and your experience in recognition of your journey and so many others that take this journey with you. What resonates with me is how you continue to center yourself and exercise agency and self-determination. It's my hope, and I'm sure everyone here shares it, that you will continue to find the hope and support that you need now and as long as you're on this journey.
Thank you very much. I appreciate the opportunity to share my experience in the hopes that by making myself vulnerable, others may take the opportunity to seek help to cope with their disease and get the mental help that can really make a huge difference in the quality of life living with cancer.
Thank you. So those are our presentations. All I can say is, wow. Thank you for all of the information and insight. I know I have a list full of questions that I want to ask and get answers to, and I'm sure our audience does as well. So now we'll move into the question and answer portion. Feel free to place your questions or your insights into the chat, and we'll draw from those. And camera stuck. I'm frozen. I don't know how to do it. How to unfreeze it. We'll just hope that the universe corrects itself eventually. So feel free to drop your questions and your insights into the chat. We do have one question for Dr. Salvador. So right now there's a lot of talk about health disparities and uses of equity lenses. And our question today is that mental health remains a sensitive topic among African Americans and Latinx communities. What are some of the major concerns that you have seen among patients in these communities?
Okay, I was unmuting. So can you repeat the last part of the question? Because it was not very clear what you were asking.
Sure. So mental health is a sensitive topic among Black and Latinx communities. What are some of the major concerns that you have seen among patients in these communities? So specifically Black communities and Latinx communities.
Well, one of the things that I have seen is how little they want to come to see the doctors. I mean, they are more prone to have a little aversion to the medical establishment. And also I think there is more stigma with mental health at this moment in those communities than in the general white population for what I have seen. I have to say that I have lived in St. Louis only a few months, so I'm talking from my experience in other parts of the country. So if anybody has a different experience here, please feel free to join, because I'm just starting to see patients here and I'm fairly new to the area. But I think that that part is fairly universal. The other thing, the other concern for the minorities is affordability and accessibility. So not everybody lives in a place that you can have easy access to healthcare, much less to mental health care. Not everybody has an insurance, much less has an insurance that covers mental health, and that we need to continue fight in this country. Mental health care needs to be part of any regular insurance, and we need to remove the barriers for that kind of care, because it's extremely important to cancer survivors, but also to other chronic illnesses, to addiction that we need to help control, to all the mental health diseases that we see day in and day out, unfortunately, come through violence in the news, and together with the problem of violence in this country. So we need to have better access for everybody, but the disparities in mental health care may be even bigger than for general health care. And that's an issue that we will need to work more efficiently, persistently, and with a very loud voice to help everyone. Does that answer your question?
Yes, it does. And if any of our other have perspectives or insights that they want to add as well, you're welcome to do so at this time. Well, of course, I have a follow-up question to that. So you mentioned that there is a hesitancy for these communities, and I would probably say a lot of communities that are historically marginalized to seek mental health services and care. What can caregivers or family members or friends or loved ones do to help support these individuals in connecting to care? Are there ways that we can encourage care, care-seeking behaviors? What can we do once we identify that this person would benefit from mental health services and support, and how can we support them and connect into those resources? And that's to anyone on our panel today.
Well, I think that the first thing is to have a clear talk to the person that is suffering from that, heart to heart, non-judgmental, very open, very lovingly, with all the compassion in the world. And then, depending on where you live, where the resources are, help them to find those resources. I mean, there are things that I am finding St. Louis has, like I found a group in the north part of town that does yoga for African Americans for free and teaches yoga that way. And I don't know how many people knows about that group. I have talked to people around here and nobody knew about it. So there is so much to offer in this town that is hidden and little pockets here and there. So perhaps if we all contribute to have a great list of all these resources and have it available online, if, especially to primary caregivers, to teach primary caregivers how to recognize when somebody is in such a distress that we really need to act and not to wait too long. I just think that it's just about approaching them, because when you're in distress, sometimes you just, especially at the beginning, you're closed up. And unless you see it, nobody's going to make you see it. So it sometimes takes what Kristine told us, somebody saying, I cannot see you anymore this way. With such a love for you that, it hurts you to see somebody you love suffering because of you. So you feel like you have to do something. Sometimes it takes that. I don't think there is a rule or something that we can make a generalization about how to go about helping people, but just being there for them and looking for resources all the time. Knowing what is available. Sorry.
I was going to say that I agree with you, Dr. Salvador, and that oftentimes I find myself, if I have a family member or a caregiver, someone who is trying to support someone through treatment, who's coming to me with voicing their concerns, it goes back to my part of the presentation where I talked about acceptability. For many people in that adjustment period after a diagnosis, they're really trying to adjust to so many different aspects of their care. And for people who love that person, it can be a really helpless feeling to know that no matter what I say or do, I cannot take this away from them, that I can't fix this for them. And so I oftentimes find myself asking, making sure that the family member or the caregiver also know that we might not be able to get your loved one to agree to some kind of mental health care, but there are also resources for you. And how do we help you cope with that feeling of helplessness and those feelings of, because oftentimes our loved ones are just as scared, they're just as afraid, and cancer then becomes kind of the elephant in the room. How do we navigate this conversation without feeling like I'm gonna cause more fear and anxiety for my loved one, or I don't want them to know how scared I really am. So it's a matter of making sure that that person also knows that there are support services that are available for them as well. That cancer, although I tell families all the time, although you are my number one, the person with cancer that we're treating is my number one priority, cancer affects the whole family and the dynamics within that family. And we want to support everyone involved.
Absolutely. Thank you.
There really is a whole approach, realizing that, the individual, the client, the individual with cancer is a part of a family system, and recognizing that the whole system needs support. So supporting the supporters. Can we get that on t-shirt? Support the supporters. I'm always a t-shirt. So that leads me to another question. Do most insurances cover mental health treatment and counseling services?
So my understanding is, as part of the new healthcare law, that insurance plans were supposed to provide, but there's still insurance plans that still provide very limited services. And now we're seeing insurance plans with high deductible plans. So even if you have insurance and maybe you haven't met your maybe you have a $3,000 deductible, you're going to be paying out of pocket for your care until you've hit that deductible. So even for people who have insurance, depending on what kind of coverage you have is going to depend on if it's accessible to you or not, if you have the resources to pay for that. Many plans do, and it's a standard copay, but many plans also provide limited coverage. So it's very plan specific.
Also, I think it varies from part to part of the country. Mm-hmm. So it depends where you live.
So, Dr. Salvador, we have a question for you. Do I need my oncologist to refer for integrative clinic? Integrative clinic. I'm sorry.
That would be the best way. But all the oncologists here are now aware of the clinic existing and how to refer people, and they have started to refer people. So that will be the best way to do. Because I am only one person, we need to have some kind of gate control, if you will. But if you cannot, there is a number that will be in the flyer that you can call if there is some, if your oncologist disagrees with you or any reason of that matter, or if you don't want to ask, that I think that you can call yourself for an appointment. But they may ask you if you have talked to your oncologist, so just to be prepared for that.
So one thing that I think was pretty consistent in everyone's presentation was the elevation and acknowledgement of barriers, which it makes sense because that's what we're doing is helping individuals navigate this landscape in light of all these barriers. So how can Siteman and the cancer care support community really elevate the experience of these barriers? How can we advocate for the removal of these barriers? And so loaded, multiple questions, right, which are not a good idea, but I'm going to do it anyway. And then how can we really work to implement survivorship experiences in survivor programming? So I guess if I can distill that question is, how can we advocate for systemic change and changing the landscape to remove these barriers? And then when we are seeing and supporting individuals through these experiences, how can we integrate that in our survivorship program?
I'll first comment and just say, from a patient perspective, talk about it. Bring it up, talk about it. Don't put it on the back burner. Make the patient aware what's there for them, because sometimes they just don't know.
Yeah, I appreciate that, Kristine. I agree that, many times patients don't know what all of the resources are available. Sometimes those things will be in a welcome packet that they receive at the very beginning, but, as many have shared, and as you shared with your experience, Kristine, it's so overwhelming at the beginning. So getting that information throughout treatment and as you transition to survivorship, being reminded, here's some different resources. And, as with the question, Melanie, about how do we address some of those barriers, that's why I am very proud to be with the Siteman Psychology Service, where, as Jennifer talked about, a lot of the barriers to care, and one of them being affordability, that with our psychology service at Siteman, we are a free service, so we don't worry about the billing or insurance part of that. And we also have that individual or group format, so people are able to meet in groups. We have groups for caregivers as well. Someone had mentioned taking care of the caregiver. So, and all of the services right now are done by telehealth too, which is not just video. We can also do phone calls with someone that doesn't have access to do video. So we're trying to address some ways to break down these barriers a little bit. But certainly, I think in survivorship program as a whole can continue to recognize those barriers on a systemic level and figure out how can we break that down at the in the hospital system.
I agree 100%, Dr. Huelsman. I think if anything that COVID has taught us is just how important connection is for our cancer patients. For a population that already, I heard Kristine mention, my family doesn't get it. Cancer can be a very isolating diagnosis, and the ability to connect virtually has been so important for our patients. I think what we could be doing is advocating that we need more funding for more psychologists, for more support staff, because I think if anything COVID has taught us is just how significant that need is. Dr. Huelsman can probably speak more to that, about how we're referring and the wait times can be significant sometimes just as a result. So we need to be advocating for more funding, more services, and to be able to continue to expand that support for patients and families.
Well, I appreciate everything that has been elevated, shared during our time together. As an advocate, I always say my heart burns. It burns from the experiences and the challenges and the struggles. But I'm also very empowered by this last question. And I hear calls to action. I hear ways that we could advocate to do what I call is clear the landscape, right? So that the need for these type of seminars are lessened. The need for these type of supports and webinars are lessened. lesson. Again, to our amazing panel and panelists and to this amazing audience, thank you for your time today and for your contributions to this discussion. We wanted to end our time today in a mindfulness activity, just to kind of center and bring us back to what needs to be centered, and that is individual experiences and making sure that everyone is okay, right? So now I'm going to turn the remainder of the program over to Dr. Huelsman. I will be back to give some closing reminders, but we're going to have Dr. Huelsman lead us in a mindfulness activity.
Thank you, Melanie. So to close out this wonderful webinar, I wanted to introduce the skill of mindfulness as a strategy to manage these difficult emotions that may present themselves in cancer survivorship. So for those that aren't familiar with the term mindfulness, there's a definition by Jon Kabat-Zinn that says mindfulness is about paying attention in a particular way. So this is on purpose, in the present moment, and non-judgmentally. That last word is a big key piece of mindfulness. Mindfulness is just simply moment-to-moment awareness, and there's many potential benefits to both physical and mental health, as Kristine kind of alluded to earlier. So there's many ways to practice this. It can be a formal practice or an informal practice, where a formal practice will be things like meditation, yoga, Tai Chi, other things that people have mentioned today, where you're dedicating a specific amount of time to your practice. Where informal practice is more about these mindful moments throughout the day. So just bringing this present moment awareness, truly focusing on what's happening right here in front of me. Things like bringing attention to our breathing, paying attention as we're walking, or even while we're doing things, that are typically mundane, doing chores around the house, really being present with that. And so there's many different resources. I wish we had more time to go into the practice of mindfulness, but you can find a lot of different resources online, and there's a lot of apps where you can practice these things, from the introductory to advanced mindfulness practice, such as Insight Timer, Headspace, and Calm, and many more. So now I'd like to walk you through this mindfulness meditation. So I invite you to find a comfortable position, seated with your feet flat on the floor and your hands resting comfortably to your side or on your lap. You can close your eyes if that's comfortable for you. Or if you prefer, just focus your gaze downward to limit any distractions in your environment. Begin here by bringing attention to your body in this moment. Notice the way you're sitting in the chair, the places of your body that are touching the chair, the feeling of your feet firmly planted on the floor. Begin to bring attention to your breathing, noticing the in breath and the out breath. No need to change your breathing in any way. Just simply notice your breathing, using your breath to anchor you in this moment. Notice the parts of your body that move as you're breathing, the rise and fall of the chest, the belly expanding and contracting. And notice where you feel the breath in your body and how your breath travels through your body. And just gently allow your awareness to rest on the in-breath and the out-breath. Now allow yourself to scan your body with awareness of how you are feeling in this moment. Scan with loving kindness from your toes all the way up to the top of your head, paying attention to any physical sensations you may be feeling. You may notice pleasant feelings or sensations, such as peacefulness, gratitude, relaxation, or calmness. Or you may notice unpleasant feelings such as anxiety, frustration, boredom, tiredness. Whatever you are feeling, just gently acknowledge it and let it be. No need to try to change or get rid of these feelings. Just allow them to come and go like a guest in your home. Whenever you notice your mind has drifted off someplace else, simply notice what took your attention and gently bring your awareness back to the moment. Focus your attention on your breathing, noticing the in-breath and the out-breath. Just spending a minute or so focusing on the pattern of your breathing, moment by moment, and breath by breath as best you can, so that you know when the breath is moving in, and you know when the breath is moving out. Just binding your awareness to the rhythmic pattern of your breathing. And now, gently begin to bring your attention back to your surroundings and open your eyes when you feel ready. Welcome back.
Thank you, Dr. Huelsman. And as we close today, I just want to say again that I'm so glad we had this time together. I also want to extend deep gratitude and appreciation for our panelists, Dr. Salvador, Dr. Huelsman, Jennifer Dunn, and Kristine Kulage. I just want to also remind you that there will be an evaluation for you to complete. So you'll receive a link via email shortly. So please take a moment to complete the evaluation. It helps us to really design content and programming that's relevant to you and your work. Stay tuned for future series and episodes. I hope to be there with you. If not in this capacity, I will definitely be in the audience, learning and gleaning from all this brilliance. And I always tend to end events by saying that in times like these, with challenges like these, I'm so glad that there are advocates like you. So thank you for all that you do. And I hope you all have an amazing day. Thank you.